In this video, we're going to be talking about flight physiology. We'll start with understanding what hypoxia is. So, hypoxia is a state of oxygen deficiency in the body, uh, and it is the deficiency is so much that it can impair functions of the brain and other organs. That's known as hypoxia. So, where does hypoxia usually occur, and what symptoms should one expect? So, although deterioration in night vision occurs at a cabin pressure altitude as low as it can happen at like 5,000 feet, other significant effects of altitude hypoxia usually do not occur in normal healthy pilot below 12,000 feet. So the other thing is that normally, although it is recommended, like you need to have it on board if you're flying uh, if you're flying above 10,000 feet, but like on a like for a normal healthy pilot, normally it starts happening above 12,000 feet. So between 12,000 to 15,000 feet of altitude, judgment, memory, alertness, coordination, and ability to make calculations, they are all impaired. And as you can understand that above 15,000 feet, everything is like worse. All these things, all these symptoms, all these are gonna be more worse. Okay, what factors can a pilot more susceptible? What factors can make a pilot more susceptible uh, to hypoxia? So again, the altitude at which the significant effects of hypoxia occur can be lowered by a number of factors, right? So the carbon monoxide inhaled in smoking and from the exhaust fumes, uh, lowered hemoglobin, and certain medications can reduce the oxygen carrying capacity of the blood. So those are the factors you can actually think that the small amount of alcohol and low doses of certain drugs actually uh, like they can render the brain much more susceptible to hypoxia. Also remember that the extreme heat and cold, fever and anxiety increases the body's demand for oxygen. So these factors are also gonna make the chances of it's gonna increase the chances of hypoxia. Okay, how can you avoid hypoxia? Hypoxia is prevented by heating factors that reduce tolerance to altitude. So, by enriching the inspired air with oxygen from an appropriate oxygen system. So, basically, you need to use an oxygen system. Okay, hyperventilation. So, hyperventilation, or also known as the abnormal increase in the volume of air breathed in and out of the lungs. It can occur like subconsciously when a stressful situation is encountered in flight. What happens is like if there is a stressful situation and you try breathing too much, this results in significant decrease in the carbon dioxide content of the blood. That's why it's known as hyperventilation, and carbon dioxide is needed to automatically regulate the breathing process. So hypoxia was deficiency of oxygen. Hyperventilation is too much breathing. Okay, what are the symptoms of the hyperventilation? Okay, as hyperventilation blows off excessive carbon dioxide from the body, a pilot can exercise symptoms of lightheadedness, suffocation, drowsiness, tingling in the extremities, and coolness and react to them with even great hyperventilation. So basically, this is happening because he is like stressful, and because of being stressful, he may do it even more. Okay, how can hyperventilation condition be reversed? So these symptoms they subside within a few minutes after the rate and the depth of the breathing are consciously brought back to normal. So there's gonna be buildup of the carbon dioxide in the body, and it can be hastened by controlled breathing. Like uh, just do a controlled breathing, and you are gonna be good to go. Okay, what is carbon monoxide (CO) poisoning? So this carbon monoxide, first of all, this gas is colorless, odorless, and tasteless gas, uh, and it is in the air, the exhaust fumes. Okay, when inhaled, even in a minute, quantities over a period of time, it can significantly reduce the ability of the blood to carry oxygen, and this is the number one cause of, like, this is another cause of creating hypoxia. Okay, how does carbon monoxide poisoning occur, and what symptoms should a pilot be alert for? So remember that most heaters in light aircraft work by air flowing over the manifold, right? So the use of these heaters while exhaust fumes are escaping through manifold cracks and seals is responsible every year for several non-fatal and fatal aircraft accidents from the carbon monoxide poisoning. So just remember that. So basically, pilot can detect the odor of the exhaust. Although the carbon monoxide is odorless, but you can detect the odor of the exhaust, and experiences symptoms of headache, drowsiness, and dizziness. Those are the symptoms. Okay, what action should be taken if a pilot suspects carbon monoxide poisoning? So the actions are gonna be whoever suspects this condition should immediately shut off the heater and open all air vents. If symptoms are severe or continue after landing, medical treatment should be sought. Okay, what is the cause of motion sickness and what are its symptoms? Not very much different from the regular motion sickness in the car. It is caused by the continued stimulation of the inner ear, which controls the sense of balance, and the symptoms loss of appetite, saliva collecting in the mouth, perspiration, nausea, headaches, and it can also create the vomiting. Okay, what action should be taken if a pilot or his passenger suffers from this motion sickness? So, in terms of the actions, remember that if you are suffering from the air sickness or motion sickness while you are the pilot in command, open up the air vents, loosen the clothing, use supplemental oxygen, and keep an eye on the point outside of the plane. Avoid unnecessary head movements. Do not move your head too much. Do not focus on anything on the cockpit. Like, do not stare at it, and try to look out. Like, to try to look outside, I mean. Okay, what is ear block? Okay, as the aircraft cabin pressure decreases during ascent, the expanding air in the middle ear pushes the uh, there's a tube known as eustachian tube, and that's gonna open. So that middle ear actually pushes that eustachian tube open, and the air then escapes down to the nasal passages and equalizes in pressure with the cabin pressure, right? Okay, but during the descent, the pilot must periodically open the eustachian tube to equalize pressure. Either an upper respiratory infection, such as the cold or sour throat or sore throat, or a nasal allergic condition can produce enough congestion around this tube to make equalization difficult. So this is known as the ear block. Okay, what action can be taken to prevent ear block from occurring in flight? Normally, what you can do is like you can swallow, you can yawn, you can tensing muscles in the throat. These are things you can do. Okay, what regulations apply, and what common sense should prevail concerning the use of alcohol? So basically, the regulations prohibit pilots from performing like any crew member duties like flying plane or any other within 8 hours after drinking any alcoholic beverage. So while under the influence of alcohol, or at least even if you have 0.04% weight or more alcohol in the blood, you are just not allowed to fly. There is also a saying actually that at least 12 to 24 hours from bottle to throttle. So you should wait half a day or a day between consuming the alcohol and uh, like doing any kind of controls on the throttle. Okay, for a pilot who has been taking over the counter cold medication, right? So, how do the various environmental factors the pilot is exposed to in flight affect the drug's physiological impact on the pilot? So, just remember that the drugs can cause no apparent side effects on the ground, can create serious problems at relatively low altitudes. So even a typical general aviation altitudes, the changes in the concentration of atmospheric gases in the blood can enhance the effects of seemingly innocuous drugs, and they can result in the impaired judgments. Okay, the regulations apply, and what common sense should prevail concerning the use of drugs and medication? So just remember that uh, our performance as pilots can be seriously degraded by both prescribed and over the counter medications. If something is over the counter, things are going to work differently in the air compared to when we are on the ground. So, the regulation says that they prohibit pilots from performing crew member duties while using any medication that affects the uh, faculties in and way contrary to safety. So the safety rule is not to fly. If you are using that, the safety rule is that not to fly. Okay, discuss the effects of nitrogen excess during scuba diving upon a pilot or passenger in flight. So a lot of the pilots uh, are also scuba divers, and in my case, that is the same. I'm a certified private pilot and a scuba diver. So what happens is like the effects of nitrogen. So a lot of the whatever I was trying to say is like a lot of pilots like to do the scuba diving too. So a pilot or passenger who intends to fly after scuba diving should allow the body sufficient time uh, to rid itself of excess nitrogen absorbed during diving. So, as you may know, that when we are scuba diving, there's a nitrogen buildup in our body, depending on how much or how long do we stay in the water. So, so if not decompression sickness due to the evolved gas can occur during the exposed to low altitude and create a serious in-flight emergency. So the recommended wait time before flight are so if you like, let's say if you wanna like fly up to 8,000 feet, right? So the recommended time to wait once you have done the scuba diving and you have the nitrogen buildup in your body, you should wait for 12 hours. Okay, and if you wanna do like you should wait 24 hours after diving, which has required controlled ascent. Right, 12 hours for not controlled ascent and 24 hours for the controlled ascent. And if you want to fly at the altitudes above, this is below 8,000, above 8,000, you should definitely wait until 1 day, 24 hours. Okay, couple of more things I wanted to cover. One is like, let's say you recently experienced a bad cold and were treated by your physician, and you continue to continue to take the medications your physician prescribed, but feel much better. Can you resume flying on your current medical and or you must see like the airman medical examiner? So remember a couple of things here that so the regulation requires all pilots voluntarily self ground themselves anytime they know or have reason to know of any medical condition that would make them unable to meet the requirements for the medical certificate necessary for the pilot operation. Basically means that if you think that if you go to the examiner right now and they're gonna fail you on some reason, then during those medical conditions you shouldn't fly, right? So if ever in doubt, you should actually look at the you should consult the AME, known as the Airman Medical Examiner. So that would be that. Okay, can you operate an aircraft while taking an over-the-counter medication for an ongoing condition like allergies or fever? So, self medication or taking medication in any form while you are flying can be extremely hazardous. Even simple home or over the counter remedies such as like aspirin, laxatives, tranquilizers, appetite suppressors, they can seriously impair the judgment. Uh, so, just remember the safest rule is to take no medicine while flying, okay, except with the advice of your AME. uh, you should you should delay the flying. That's all I wanted to cover. Thanks for watching.